I am Divyah from Group 25. Today I'll be talking about examination and noticing congestive heart failure. Let's start with what is congestive heart failure. So congestive heart failure, or sometimes known as only heart failure, is actually occur when the heart muscle doesn't pump blood as well as it should. So when this happens, the blood often backs up and fluid can build up in the lungs, causing shortness of breath. So certain heart conditions such as narrowed arteries, like the coronary artery if it narrows, or high blood pressure. So this gradually leaves the heart too weak and also stiff to fill up and pump the blood properly. One fun fact that I would like to explain to you guys is that heart failure can occur both on the right side and also on the left side. Okay, so the right side, it is also called as cor pulmonale. So this causes the blood to back up in the venous system, and also because of the right ventricle's ability to pump the blood into the pulmonary circulation is impaired. So in a person with right-sided heart failure, the veins in the legs and abdomen become swollen. So this is main symptoms that you have to see, main signs that you gotta see. And also left-sided heart failure. So left-sided heart failure is known as congestive heart failure because the blood is backed up in the lungs because the left ventricle's inability to pump. So this makes the systemic circulation impaired. So the excess blood in the vessel of the lungs causes fluid buildup and also fluid to leak into the lung tissue. So this leads to congestion and also breathing difficulties. So for demonstration for visual purposes, I would like to show this picture because in this picture you guys can clearly see that congestive heart failure. You can see how the left ventricle is like built up to like thicken. So I hope this helps when it comes for visualization. What causes this congestive heart failure? So first, let's start with the main coronary artery disease. So this is a disease when the artery that supplies blood to the heart is affected, and then high blood pressure, cardiomyopathy, the disease of the muscle of the heart, cardiomyo, it's the heart muscle. So the disease that is related to the muscle of the heart, valvular heart disease, the heart disease of the valves that is present in the heart, diabetes, any disease covering the heart, arrhythmia, irregular heartbeat, severe infection, thyroid disease. These are all some of the causes of congestive heart failure. So whenever we are recording a patient's history or whenever we read a patient's history, if a patient's history consists of this kind of disease background, so of course always be careful, always observe them for any congestive heart failure signs or symptoms, always examine them, always inform the head nurse if any symptom aligning with congestive heart failure is observed. Always inform the doctors, inform the head nurse. Next, let's start with examining and also noticing any observation when it comes to congestive heart failure in the patient. First, always check sign for any hemolysis. Cardiovascular conditions such as left ventricular systolic heart failure may lead to pulmonary venous hypertension, leading them to cough out blood. So, for example, for a patient with cardiovascular disease, this is one of the common symptoms. Always check for any neck vein swelling. Also check for congestion or any fluid accumulation in the lungs. Furthermore, we should always check whether the patient is going through a cyanosis due to lack of oxygen and also shortness of breath. Also check for edema such as swelling in legs, ankle, feet, and also swelling in the belly and abdomen area. Signs such as patient's inability to lie flat at night. So patient may not be able to lie flat, but they may be sitting in an upright position and feel better. Also, the patient may have orthopnea. Orthopnea is a difficulty in breathing unless the patient is sitting upright. Check for acid test, fluid collecting in abdomen. Also, if a patient is fatiguing easily is also one of the factor. Stand in the side of a patient and check their pulse. At the same time, check their respiratory rate. Check for any rapid or irregular pulse. Check whether the patient's respiratory rate is whether they are having dyspnea or any other abnormal respiration. Always check for any pulse deficit, which is when there are fewer pulses in the artery than they are heartbeats. So always run a few tests to confirm any suspicions and also report to head nurse and doctor.